we're actually really excited to welcome general visitors back.
Visitation to long-term care facilities will expand in phases beginning this week, according to Shared Health.
We've got some good protections in place, so we're like I say, happy to welcome people back. It's been a very difficult time when we're not able to allow visitors in.
The first phase of expanded visitor access will allow fully vaccinated general visitors to both long-term care and acute care facilities, with proof of vaccination and photo identification still required. Visitors who are not fully vaccinated or who do not wish to provide proof of their vaccination status may visit long-term care facilities in designated visitor shelters or spaces.
There are other changes coming that we're not so sure about.
Simpkin Center CEO Lori Cerquetti says although expanded visitation is a win, the impending end of proof of immunization and mask requirements is a concern, especially since they only declared a near 2-month-long outbreak over just last Tuesday.
We do have the frail elderly and young children that we do need to continue to protect. And if wearing a mask is going to be something that will help protect people, I encourage people to continue to do that.
Epidemiologist Cynthia Carr shares concerns about the speed in which measures are being removed, as she says it creates an opportunity for the virus. Carr also believes visitation is key for not only the mental health of those in personal care homes, but their overall health as well.
Enhancing visitation opportunities at our long-term care settings is a very good idea, but it needs to be done safely. And so we need to have, not just a social contract of people who are visiting that are going to be very cautious and careful and honest about any symptoms or potential exposure, but additional layers within the setting for the next little while, I think would be advisable, particularly because we're still in a cold weather situation. So the majority of visits will continue to be indoors, which is, less safe than if you can have a mix of people indoors and outdoors.
Carr says in Canada, 60% of deaths from COVID-19 were aged 80 and older. She hopes long-term care home staff continues to be supplied with proper PPE to keep these residents safe. In Winnipeg, Mike Albanese, City News.